Okay, so it's not 17 p.m. Welcome everyone to the first webinar on mental health of Equipo Europa. It is a truly pleasure to have you all here. My name is Inés Suñer, and I'm a member of the Equipo Europa and of the EU Youth Lab project. And well, as most of you might already know, Equipo Europa is a youth-led organization whose aim is to bring the European Union closer to the youth and to promote youth participation in European affairs. And as such, we always try to address the topics that most concern the youth, as it is the case right now, unfortunately, with mental health problems. As you probably all know, since the pandemic, mental health issues across the European Union have increased. And whereas the mental health of Europeans was already a matter for concern before the COVID-19 pandemic, the latter has resulted in a substantial increase in symptoms of depression, of anxiety, of suicide rates, and other symptoms of mental illness across Europe's population and especially among the youth. So it is for this reason that at Equipo Europa, we decided that we had to dedicate one project at least to this topic, and we decided to dedicate one of our core projects, that is the EU Youth Lab. So we decided to dedicate it to mental health, and a group of young researchers, we are researching, analyzing, and creating proposals to improve the mental health of the youth across the European Union. So in the framework of such project and in the month of mental health, I don't know, maybe some of you already saw in social media that the 10th of October was the International Day for Mental Health. So as such, we decided to do this first webinar during this month and to raise a little bit more of awareness to what some already call the silent pandemic, and share with all of you what is the current situation of mental health in the EU, how is it affecting the youth, and what policies are being taken or should be taken to improve it. So to do so, we count today with two experts in the topic. And so I'm really happy to present you to Laura Marchetti. She's a policy manager at Mental Health Europe, and to Irene Pujol, who is one of the co-founders of Equipo Europa and a mental health activist. So first of all, welcome Laura and welcome Irene. It's a truly pleasure to have you here. And
Thank you.
And well, just for you to know a little bit how is it going to go, the webinar will have a first part in which both speakers will share with us their knowledge in the topic at hand. And after, you will all have the chance to ask them the questions, the doubts, the concerns you might have concerning this topic. The comments, you can leave them in the comment section that you can see in your screen. And I will then ask them for you to both speakers. I also suggest if you can put, when you ask the questions, and next to the question, the name of the panelist to which the question is addressed, that would be wonderful. That way we can deal it quicker. So without further ado, Irene, I'm going to start with you. What are the main mental health issues which young Europeans are confronted with today?
Thanks a lot, Inés. And first of all, thanks for having me here. It's a pleasure to be at what used to be kind of my home and see how this project has grown, to cover all these different issues that matter to young people, and to share the panel with Laura, with an organization that I'm a fan of. Saying that. I also wanted to say that I don't consider myself an expert, but I'm talking from my experience. Unfortunately, I lost my baby brother to depression less than 2 years ago. And even though I wouldn't talk much about that, but I have had my own mental health struggles since then, but also before. And well, since my brother died, I've been outspoken about it, and this has allowed me to have many genuine and open conversations with friends and other people that have shown me how widespread some mental health issues are among the youth. And well, beyond that, over the last 2 years, I've tried to research a bit more about the different drivers of all these challenges we seem to face. But starting with a few facts, the few facts that I'll probably give, then it'll be just experience. UNICEF published recently a report talking about mental health among the youth and children, and they found out that in Europe today, suicide is the second leading cause of death among young people, and that 3 adolescent lives are lost because of mental health difficulties in Europe every single day. Like 3 young people died because of mental health issues. Like I think we need to stop and reflect on that for a second. Beyond those that are lost, 9 million teenagers in Europe aged between 10 and 19 are living with mental health disorders, with anxiety and depression accounting for more than a half of all the cases, and eating disorders being also widespread. So those will be, I guess, like the main mental health illnesses and challenges, like on the spectrum of the disorders that are in themselves, like I will say, like a pandemic on its own, and a crisis that we need to take care of. But we can go even beyond that to talk about issues that might be more widespread, and that even if not reaching the level of these disorders, can lead to a poor mental health, or like a poor emotional like well-being of like many young people, and that I'm sure like many people here listening to us can identify themselves with. I'm talking about like patterns of thoughts and feelings, such as like feeling like you're not enough, being perfectionist and exigent with yourself. So considering that you never do enough and you need to do more, that feeling guilty if you're not productive, having depending on the time you're at, the age you have, and like your career, risking burnout, not knowing what to do with your life, like being in an existential crisis at different points in time, also when you thought like everything was clear, and suddenly wondering. I feel like and this is again based on my experience and my conversations with many friends and colleagues, that like many of us are like really uncertain about the world and like our place within it, and feeling lonely as well sometimes, even if we're like really connected, and helpless, and also like the feeling of helplessness about the world. So I don't know, like many feelings that can be normal to some extent, and that it's good to acknowledge. I think it's great that we're giving like mental health and like the fact of like not being okay like a place in the public sphere, and that we're normalizing it. But at some point when like everyone is like developing anxiety because they think they are not smart enough, or like not pretty enough, or like that they should be having more fun because they are missing out, and like everyone is doing something, like everyone seems to have life under control while they aren't, and feeling lonely because of that, while like everyone is feeling the same way. Those are things that we need to think about, and start to treat as like collective problems rather than individual ones. So I think it's great. I go to therapy, and I recommend everyone to go to therapy. But like I feel that there is this feeling of like not being okay, that well, at some points like it's okay. So it's okay if you're not okay like a few days, like one day, like during periods of time when it's so widespread in time and among people, must make us like think about the reasons, like, and the structures, like the social drivers of that unease feeling. And well, I've started to research only recently about it. I just created a project or like community of young people seeking to understand more like the social, political, and cultural drivers of all the different mental health challenges that we face. And so far, like, I mean, again, I am not an expert, and this is just the beginning. But I feel I've learned two things, and one of them is that as social species, we have like a strong need to belong and be valued in a world that makes it really hard to feel that way, because we are surrounded from like the school system to what we see on social media or like in advertising campaigns by standards that can be unattainable. We see posts on LinkedIn of like people showing like their successful careers, and we see celebrities on Instagram that look wonderful. Well, we are like what we are, and those pressures. And I want to emphasize also the educational system that like puts like makes us from very young like to identify ourselves with a grade, have an impact on or like perception or like self-esteem and or feeling of belonging, right? So that's one of the problems and one of the things that I think we need to analyze and discuss more about, like what can we do about it. And the other one, like quite related, it has to do with our upbringing and like the system in which we live, where we have been raised and are like constantly for long now, even if things are starting to change, we have been told that we need to be fine, we need to be perfect, we need to be in control, that we can do anything we want. Like I think many of us were raised with that idea. You can do everything you want in life. You reach all your goals if you put a little effort. But then we've realized things are more complicated than they were like framed to us, right? Like we are in a world in crisis, in a world in flames, and the way we've been trained to be has made us need to address all those problems and to try to be in control in a situation where it's really hard to be in control, because the world it's uncertain. We live in unprecedented times, like they tend to say. So that generates another clash, and it's also something that we need to explore, and that it's partially caused by how, for many years, we've tried to hide, especially during our upbringing, like the bad things about life, suffering, and that makes us like, so like the typical criticism, right? At least in Spain, I don't know if like the term exists in English, but they call us like the glass generation, like saying we're like fragile and like sensitive. I don't think that's the case. I think we're quite strong and like one of the first generation to be able like to express how we feel. That is true that we are less tolerant to frustration, and that we didn't expect the world that we've had to deal with, and that we need to develop like the tools to deal with the complexities and the challenges of this world. So I think I'm saying too many things here, but well, I just wanted to emphasize that there are like many things that like are part of our like our day-to-day life that can contribute to a poor mental health or like poor emotional well-being, because we need to make a distinction between illnesses and like the normal state of being, but that if they are not taken care of, like can turn into these more serious disorders. So I will end this like question, or like this answer to the question here, and leave more room for like the discussion afterwards.
Thank you very much, Irene. That was super interesting. I will wrap up a little bit of what you said. So I stay with the fact that most of the mental health disorders among the youth would be anxiety, depression, and eating disorders, among many others. That it's truly a silent pandemic, especially among the youth and even teenagers and children indeed. That mental health is not just disorders, it's not just having anxiety, but that there are other things that are part of our brain and of our patterns of thoughts that can lead to further disorders if we do not address them properly, such as being too perfectionist, not always this feeling of not being enough, among many others. So I connecting a little bit all this with our next panelist, Laura. How can public institutions improve this mental health, all these problems that we see clearly that the youth are being affected by? How can public institutions improve their mental health at the European level? One second, because I think you're muted. Just
sorry. Can you hear me now?
Yes, perfect. Thank you.
Good evening, everyone. Before diving into the question, I realized that maybe not every one of you is familiar with my organization, so I'll say a few words about who we are and what we do. We are a European network organization, which means that I represent the office, the secretariat in Brussels, but we have members in different countries, including Spain. And we work on mental health from a very broad perspective. So we work on mental health both from the perspective of the rights of people with mental health problems and ensuring that the rights are respected and not violated. But at the same time, we work a lot on well-being, which includes a lot of work on prevention, a lot of work on awareness raising. And we do this in collaboration, of course, with our members. And we are also very proud of having a membership that is quite broad, in the sense that within our members, we have persons that have or had experience of mental health problems, as well as their families, given that a mental health problem of a person is never an individual problem, and it touches upon the environment that this person is in. We have service providers and public authorities within our membership, so the side of those people that provide care. We have association representing certain categories of professionals, like psychologists, like nurses, for instance. And we also have academics, given that the research side is also very important. So we really try to have a broad membership to ensure that what we do takes into account all the aspects of mental health that are relevant for the individual. And the only entity that is not a part of our membership is the industry, in particular pharmaceutical company, because even though medicines can have an impact in the therapy and in the recovery process of a person, it is also true that industry as an interest that is a bit more economic sometimes. So we try to collaborate with them, but we want to really be independent from any influence of the industry. And I'm saying this because I know it might sound silly, but it's actually quite an important aspect when it comes to advocate for mental health, which is what we do. We try to improve the well-being of people and the rights of people with mental health problems. Me and my colleagues, we do this in Brussels with mainly European institutions, as in both from the EU, but also other type of institutions. And our members do this at the local and national level. So taking this into account, going back to the question, which was how can public institution improve the mental health of people in Europe, and I guess of young people in particular. In our opinion, there are different things that can be done that are already happening, but they can be done. And going back to what Irene was also saying, in the past few decades, there has been a broader understanding of what mental health is and what mental health problems are. For many years in the past century, there was this idea that mental health problems were connected to some issue with the brain and only related to brain functions. However, research has pointed out to the fact that there aren't really biological markers that can actually reliably predict whether a person with a certain type of brain is going to have a problem, as in a mental health problem. So basically the same things that you can do with certain physical disease, you cannot really do with mental health. And at the same time, research has also pointed out to the fact that the factors that can influence a person's mental health are not just physical and within the person, but they come a lot from the outside, from what in the jargon we call socioeconomic and environmental determinants. So issues like experiencing poverty, experiencing certain level of stress, certain life events, or certain period of life, regardless of socioeconomic condition, certain period of life, like for example, moving from the educational system into the job market, are extremely stressful moment for a person. And if support is not provided, if people are not aware of mental health problems, and if they are not feeling comfortable seeking for help because of the persisting stigma, this of course can be problematic and can lead to more problem. So in our opinion, what public institution can do is to take an approach to mental health initiative and mental health policies that goes beyond the mere and the sole health aspect, in the sense that for sure healthcare and health policies are an important part of mental health, particularly when it comes to ensuring that everybody can have affordable access to mental health care, which unfortunately is not the case for many people. At the same time, expanding mental health to other fields of policies like education, like employment, like social policies that look into providing certain type of care and a certain type of support to people that are more at risk of social disadvantages. This is something that public institution can do, and it's very concrete, and is ensuring that basically certain risk factors that can be certain life events or certain period of life, or again experiencing certain socioeconomic disadvantages, does not exacerbate and does not lead to a permanent or more prominent mental health problem. I think Irene was mentioning this already before. We all struggle with certain difficulties in life, and this is kind of just a part of life that we need to accept. The issue here is then when this issue become constant, when this issue become very much of a burden, and when this issue become a problem for us that prevents us to live in a way that we find meaningful and contribute to society. So these are aspects that public institution can address through certain policies, through allocating budget. A lot can be done, for instance, when it comes to stigma, particularly in young people. We see that there is this kind of mismatch between, on the one hand, the awareness that young people have about mental health, on the other hand, also unfortunately because of the pandemic, not many young people access services when they need to. And this is something that we've seen from our members as well, that they were telling us in the past years. So since lockdown and restriction measures start to be lifted, many young people started to seek support, but their level of distress and mental ill health was way advanced compared to years before. And this was because for many years, for a couple of years, they didn't have access to mental health care because of the whole restriction. It was quite difficult, but also because we all lacked those kind of red flags that in normal circumstances would tell us that something is wrong. And this was particularly true for young people that being deprived of schools, of social interaction, of leisure time, of activities, whether this is sport or cultural. These are all activities that put us in touch with a network of peers or a network of friends or a network also of people that are older than us or younger than us. But that by interacting with these people, we are actually able to detect whether we are not doing fine. And for 2 years, we were deprived of this. And this was particularly heavy on young people because this is a particularly, when it comes to kind of emotional intelligence and emotional development, the period of the adolescence, early 20s, from a psychological point of view, it's quite delicate. And we had a whole generation that for 2 years could not communicate the way they were used to. And so when restrictions started to be lifted and many young people realized that actually they were doing way much worse than what they thought, they started seeking for support. But they started seeking for support way much later. And this support was not accessible for everybody because maybe it wasn't accessible because of cost. Maybe it wasn't accessible because people did not know where to turn to and ask for help. So these are also concrete aspects that public institution can address. First of all, creating awareness among the population, particularly young people. And how do you do it? You do it taking mental health in schools, taking mental health in the educational system. So it's not just kind of something that young people use to discuss on social media, for instance, which is mental health is a very big aspect of some profiles, some social media profiles, but is also discussed in schools through awareness raising campaigns, but also through providing information to young people on where they can seek support. This is something that can be done. Another thing that can be done is making support accessible. Often, in many countries, mental health support is considered to be a bit of a privilege problem because only people that have certain budget can allow themselves to pay for therapy or to pay for any type of support that they might want to. So making allocating budget so that this support can be accessible also for that part of the population that would normally not be able to cover financially for it. It's very much important. But also ensuring that this is done throughout. So through program and project, for instance, that look at those aspects of life, like the transition from studies to employment, that this is particularly delicate moment for many young people. So putting the attention on this part of life to people and ensuring that, first of all, they don't feel left alone, that the struggling in certain moment of life is very much normal. But then providing them with some tips or some sort of guidance on where they can seek support and when they can kind of test the temperature and know this is actually starting not to be quite well for me. I think I'm going to stop talking here in case there is any question or, but yeah, I could talk more, so I'll stop here for the moment.
Thank you very much, Laura. I think that was super, super interesting as well. So to wrap up a little bit too, I'll stay with the fact that, of course, mental health problems do not come set in our brain, but there are many social factors that influence whether you have a better or a worse mental health. So there's a solution and many things can be done. And regarding this precisely to the fact that what can be done, I'll stay with several ideas you mentioned. One would be the fact that it is important, of course, to take care, to do policies of mental health in the health aspect, but also to have a more transversal approach to include the mental health perspective in many other areas of policymaking, such as education, such as employment. to deal with the stigma that there is around mental health, especially among the youth, and to create awareness among them, to discuss it in schools, to provide information to where they can seek support, and also to allocate budget to mental health so that everyone can reach therapy, everyone can seek the kind of support they need to have it whenever they need it. So now going back to you, Irene, and a little bit, you already mentioned this in the first part, but I would like to ask you, because I'm pretty sure that many people in the public may wonder or may would like to know that. What kind of tips or ideas would you suggest them to maintain a good mental health, precisely to avoid reaching these disorders, no, that you were mentioning, anxiety or depression? How can, the same way we go to the gym, or we do some sports, or we meet some people to be more fit or whatever, what kind of things people can do to improve their mental health, or to keep a good mental health and emotional well-being in their daily basis? Easy tips that they can do. Which ones would you recommend the most?
Sure. So, well, each person has to find its own system, of course. What works for me perhaps doesn't work for you, but still, there are some common things that tend to be mentioned and that work for me in my case. I like when I feel super stressed, or like I'm overthinking a lot about things, like go for a walk. I love to listen to music. Like, music always helps me, like, to uplift my mood. Play with my cats, for instance, and talk to friends in general. Like, being vulnerable, like being real. It's one of the things that has helped me most, because sometimes we think we're the only one feeling like the way we feel, and like when you talk about it, either it helps you rationalize a bit, like realize that your thoughts perhaps were like quite messy in your head, and it's not what you thought. Either like it shows you you're not alone, you're not the only one experiencing that, and that's actually super helpful. Also, like feeling understood and like being able like to kind of work together through it. Then of course therapy, like I always recommend it. Like there is a point where like going for a walk is not enough, like because you don't even have the energy for that, right? Like I could recommend these things to my brother in the past and they were not enough. So sometimes there is more work to be done, but again, there's so much one can do, including therapy. Like, and I just want to mention one example to explain this. I have a friend that works in like one of the big four, right? And that it for like the past 2 months has been forced to work like 24/7. With unrealistic deadlines and bosses that seem to care more about like profit than the health of their workers. And like a few days ago, she told me, "Oh, I've decided I need to go to therapy." And I was like, "Well, that's great, but like, I don't think you need to go to therapy. Like, what you need is less hours of like work and more time for yourself, right?" So yeah, it's not only, it doesn't depend only on us, but also on the conditions around us, as I Laura was stating. And yeah, another example, and I'll finish with this. Another thing that works for me is like putting limits on social media use, but that's difficult too, because like the latter are designed knowing how our brain works to make us addicted to it. So yes, we can use several apps to reduce or use like the time we spend in front of our screens, but perhaps we need some legislation regarding how the latter are like designed and change the attention system that adds at its framework. So a few things that we can do on our own, but other things that we need to do collectively.
Wonderful. Yeah, I totally agree with many things that you say. I also do them. Go for a walk, talk to friends, listen to music. I think what you said is true. Like at the end of the day, if you share how you're feeling, you show yourself vulnerable, which sometimes in the society we live in seems to be really hard because you might fear that you're being judged or that you're going to be alone or whatever. At the end of the day, it turns out that when you share it, you're not so alone. Most people feel like you do, and it helps. And of course, as you said, when going for a walk is not enough. Going to therapy, of course, it's also really, really useful. So I think that was very, very useful for everyone. And finally, Laura, I wanted to ask you, although you already said it, but what would be, among all the things you said, the policy initiatives that you would think are most needed to improve the mental health of Europeans? What would be the more urgent right now among all that the ones you said?
Well, for us, given that with my office we work mainly at the European level, so we interact mainly with the EU institution, we have been calling for a few years for a mental health strategy or a mental health action plan. So something that is coordinated by the institution, by the Commission, and implemented at the national level. And this is for many reasons. First of all, the EU as such does not have any initiative on mental health at the moment, besides allocating some money for a project. But allocating money for a project without some sort of concrete, strategy with objectives and benchmark, it's just a project. It can be helpful for a few people, but it's not going to necessarily solve the problems in the long term. While a strategy can be a bit more effective in this. It can provide certain objective with benchmarks and ideally money allocated to it to implement it. Then at the same time, it would somehow bypass a bit of a kind of administrative legal issue that there is at the European level, which is that when it comes to mental health, the EU as such does not have full competencies because it's member states that have competencies on the mental health policies. And in every member state, this becomes even more complicated because the health sector and the healthcare, the healthcare system in every country works differently. You have countries where everything is centralized. You have countries where from one region to another, this can change. So having a coordination, having a mental health strategy can help in this, not necessarily because it will lead to change in the health system of countries, which we are pretty sure this is not going to happen, but having a coordinated action, it can ensure that everybody is working towards the same objective and every system can fit into, can work within their own environment towards a certain goal. So this is what we have been calling for a few years, and we find it the most pressing issue, an effective issue to address at the European level.
Wonderful. Yeah, definitely coordination has always end up being a super nice and super useful tool in the European Union. We have seen this with the Next Generation funds. So I think definitely coordinating, despite, of course, there's not the same mental health systems in every country, but coordination can certainly lead to one, at least that we are all going in the same direction and we can find this. So yeah, with this, I'll end up this first part. And now we will go to the comment section to see the questions. But first, I wanted to share, Laura was sharing with us as well, that there's a guidance for young people that Mental Health Europe has elaborated that might to people that might be experiencing mental illnesses. So in case it might be useful for the participants, I will share it now if I can, or if not, in the comment section, so that everyone can have access to it.
Yeah, I'm not sure. I don't think I can write in the comments. I can see them, so I just shared it with you, but feel free to share it. Yeah, thank you, David.
Yeah. Wonderful. Yes, so, oh my God, we have a lot of questions. That's super nice. I'm going to start with Ana Lucia Martin. She's saying, yeah, we already addressed this, that the European Union countries have different mental health systems. expensive. Yeah, of course, in Spain we have a really truly problem with the fact that most therapies are private, and you have to wait in the public system for like months to have therapy. And yeah, she compares it with Germany as well, that it has a different systems. Yeah, exactly. So the problem with overloaded people waiting and waiting. So she's asking, where does the European Union find a solution for the formation of more psychologists qualified for the needed therapy the European population needs? Because in Spain, yeah, exactly, there is the problem that we have the exam to become a public psychologist, but also there are not enough seats to become it, and not despite there is a huge demand for therapy. And she was asking as well, what can the EU do for the education and academic system for mental health? So that would be two questions. I don't know if Laura, would you want to?
Yeah, I can quickly address this, because this is actually a topic that it's quite relevant throughout the EU, so the lack of adequate staff. And from the specific EU point of view, this is also an area, education is an area where the EU doesn't have full competencies. So what the EU can do is try to coordinate more the work that different countries do, try to promote more exchanges, because we see that in some countries maybe you have more professionals that might be willing to move to another country. So it can really facilitate this part, and it can facilitate through making education, certain type of medical education, a bit more accessible through maybe, again, funding. And I'm not talking necessarily about funding to give to people to study, but funding to ensure that university can, have enough spaces for enough people. So it's not just about funding for the students to go through the studies, but it's also funding for the university to be able to train and form professionals. But more than that, I'm afraid that this is not much that the EU can do, because education is like healthcare, not an aspect where the EU can do much besides coordination, unless member states are willing to give part of the power, which is never the case. But it can provide exchange, like it can try to coordinate through exchanges, not just of people and professional, but also exchanges in terms of really putting people from different educational systems together and try to see what the others do, and kind of share their practices and knowledge. This is something the EU does quite a bit in the field of education. Another things that can be done, I mean, I know it's very specific, but through our members, particularly those that are working in services, we see that one of the issues that there aren't that many people that in this sector is because it's a hard job. It's not an easy job. So there is also something here that the EU can do beyond the educational part. So beyond ensuring that there is enough staff, how to keep the staff, basically, how to make working condition acceptable and human. And this you do through regulation, through putting minimum wages, but also looking at working condition and working hours. This is something that you can do, and it's a bit more concrete. And so, not just how to train people, but how to keep people in a job that is not easy, because you're pretty much working with people that are not doing well. And even though we try to remain professional, it's not an easy job to go every day and talk to people or support people that they're really not doing well. So providing support to the staff, providing support, ensuring they have respite care, or ensuring they have enough time outside of work, through leaves, through certain types of arrangements, but also ensuring that the condition in the job are excellent, because it's really a hard job. So you really need to convince people to go into that direction. I hope I answered, Anna, Lucia.
Yeah, thank you very much, Laura. So we have another question from Carol, this time for Irene. Do you think the internet or social media are factors that increase mental health problems among young people? And how can we use social media in a way that does not affect our mental health?
I mean, for sure, like it's one of the key issues, right? Like one of the key drivers, I believe, of like the increase in mental health challenges among young people. Uh, Due to the way they're built and how they transform our brains and like the way they operate. For this, I recommend like there's an organization I love which is called the Center for Human Technology. They have some podcasts where like they explored like the impacts of technologies and social media on both mental health and democracy. It's are really interesting. And yeah, I mean, it's what I talk about, right? Like, which factors? I mean, comparison. We compare ourselves. Like, it's the way we are. Like, because we need to belong, and it's part of our nature. And like, social media give us like a framework, like where we can compare ourselves like to millions of people. Like when our brains, in theory, like some studies said, are like only made like to be exposed like to the lives and like the opinions and everything of like 150 people. So that creates an issue. And that's just an example. But about what can we do like to use social media in a way that doesn't affect our mental health. On an individual level, I guess that there are a few things. Like as I said, I mentioned several apps I use, for instance, like I don't know if I'm allowed like to say a specific names, but I use one app that is called like 1sec that has helped me a lot because it makes you think before like entering like an app. So like we do these things sometimes without thinking, right? Like we're like waiting in line and then we just enter Instagram and like then we're floated and like we lose ourselves in this rabbit hole. So like this app will make you breathe before like entering the app for like it's 30 seconds I think, but 30 seconds is already enough like to make you being intentional about what you're going to do. And that slowly reduces like the amount of time you pay. Then what else? I will say like eliminating perhaps like the accounts that you realize have an impact on how you feel. Like just follow those that are like positive for you, that make you feel better, and also be that person for others. Like I try to think about what I post when I post things. Like, am I doing this like because I need the likes, or like I need to show that like I'm living a perfect life when realistically I'm not? Can I be more real? Can I show things that are like funny or like interesting to people, but that won't make them feel like they are not good enough, or like they are not living the things that I'm living? So there are things that we can do also like to help others. But finally, as I mentioned before, like I think there's a lot to do on the field of policy and legislation. And I think here it's a domain where like the European Union can do things. And correct me, Laura, if I'm wrong. Because and they are like trying to do things already. Like I think regarding like social media companies like Facebook. So it's a lot of work, but it's something that it's a starting point, I'll say.
Thank you, Irene. Then we have 3 more last questions because otherwise we'll be running out of time. The third one would be for Laura. Von der Leyen, there's Xavier who's saying that von der Leyen mentioned the need for the EU to develop a mental health strategy in her Soteo speech. Could you comment a bit about this initiative briefly, and what can we expect about it?
Yeah. So what we know from it is that first of all, we know it's not going to be a legislative initiative, which for us it's a bit disappointing, given that of course it's something as a bit of a legislative aspect, it has more meat to it, and it's basically binding, so it has to be done, no? But we know it's not going to be a legislative initiative, but we know it should be out by next summer, and we know that it's going to take an approach to mental health that doesn't only look at the mental health problem aspect, so people with mental health problems, but it's going to look at the well-being part more in general. So really mental health for everybody, as in everybody has a mental health and everybody needs to work on prevention and care for their own well-being. So this for us is quite positive, because often when it comes to mental health, the conversation becomes really narrowed down to people that have received a diagnosis, which is of course important, but we know that a lot of diagnoses can be prevented if there is enough work done on the well-being aspect. So for us, mental health is not just about access to care, it's also about prevention, and both on the side of educating people, but also on the side of ensuring that the system that we live in does not create barriers for our own well-being and does not create additional level of stress. So this is what we know from the initiative. For the rest, we will find out in the next months. But we're working on it, so for sure we were getting involved.
Yeah, wonderful. I think that would be super good, because that way we can little by little advance a little bit more in this area, and hopefully we will in some years talk in a different way about mental health in Europe. And now just to finish, there were two questions, last ones. Yeah, I think this one is interesting, because we always talk about the person who's suffering mental health issues, but what about those who, a little bit you were already elaborating, Laura, before about taking care of the carers in a way.
Yeah.
How can we address and help those family members or those friends who have to help as well the person who's actually suffering mental health issues? And this question is for both of you, so if you wanna elaborate on that.
Maybe I'll let Irene start. I think she has more personal experience on this, and then I'm happy to. If there is more to say, I'll speak after her.
Yeah. Well, thanks for the question, because it's a great question. It's a question I've asked myself indeed. As I dealt with the depression of my brother, there are not enough tools. I feel perhaps it's not the tools, it's the access to these tools, right? I found many things I wish I found before, later, navigating, but I think it would be great if families and friends had an easy place to access this information. For instance, schools, or doctors, people that we tend to see more often, that could point us when we deal with these situations, to the best organizations or tools, or documents to train ourselves, to know how to treat the people we love when they're having a mental health disorder, or dealing with some issues. And then education. I think since we're young, we should be trained to understand more our own emotions and those of others, and how to interact well, having more emotional intelligence,
Definitely. Laura, I don't know if you want to add on that something, or...
Yeah, I mean, for us, this is actually quite an important topic, because we often see that usually if someone starts not doing well, the people around them sooner than later also start not doing well. So on this, from a practical point of view, I would maybe suggest to have a look at the guide that we shared here, because there is a whole section about how to, if I know someone that is not doing well, what do I do? And there is also a part about, putting yourself your barrier. So I think that the main suggestion that I would have is that your own well-being can only be well-being if you put barriers around you. And this also comes with the acceptance that we cannot save everybody, and we are not meant to be saving everybody. So putting your own barriers in terms of what you can do, and that this is the best that you are doing without feeling guilty that maybe that's not enough. It's a very important aspect and it's a very important mindset to really try to develop. And I know that is not easy. It's very easy for me to say it right now, but when you find yourself in a situation where someone you love is not doing well, this is not an easy thing. But you cannot help someone that you love if you're not doing well. So first and foremost, put barriers and take care of yourself, and then when you're fine, you can help others. And for this, we have put a few tips on how to do it concretely, how to talk about certain things, how to educate yourself on certain things, so you can really be of support without burdening yourself with the idea that the well-being of the person depends on you. That's really not the case. And I hope that the guide can help you in this. And I was looking, if I find it, I know of a project that is specific to the mental health for carers, and I would like to share it with you because they also produced a lot of material which can be useful, but I hope I can find it.
Great, thank you, Laura. So while you look for this, I'm gonna do a little bit of wrap up and of conclusion. I think it was a really, really insightful debate and a really interesting, because we really approach mental health through a lot of areas. No, we said that, of course, mental health is definitely a huge problem right now. Well, not mental health, but the problems of mental health are really a huge issue among the youth, among teenagers, among kids, and that definitely many things can be done and should be done. And this can go from not only tackling health policies and preparing health policies, but also addressing it from many other policies, because, as we said, mental health is something that is affected by many social factors and not only something that comes within you while you were born. And that when we talk about mental health, we don't have to forget that it's not just about mental health illnesses, but it starts way before. And if we want to prevent mental health illnesses, it is precisely all of these tips that you were giving that we have to take into account. We have to take care of ourselves the same way we easily go to the gym, or we don't doubt in taking care of our physical health. We have to also take care of our mental health, emotional well-being first. And that way, such as Irene was saying, go for a walk, talk to a friend, etc. Many, many things. And just break the stigma, break the taboo, and little by little, I think all of us can improve not only our mental health, but the mental health of those who surround us. And I don't know if Laura, have you find the link?
Yeah, I put it on the chat. It's actually a project specific to young carers and their own well-being. So I put the link in our private chat. Feel free to share it, and I hope you can find information there. There is a booklet, there is a bit of material. It goes a bit more into depth than our short guide, so hopefully it can be useful.
Wonderful. Yeah, I think it's already, and also we would like to share also the project that Irene is involved in case someone wants to join or is really interested in mental health activism. I'm going to share the Instagram here as well for those of you who wanna have a look. They're doing actually also really wonderful work there. So I would like to thank you both, Irene and Laura, for this time with us. I think it was really, really interesting. From our side at Equipo Europa, we will also try to improve the mental health with this EU Youth Lab, and we will try to make proposals, bringing to the institutions both at the national, the local, and the European level, to also give our a little bit of, as we say in Spanish, a little bit of small stand to the thing. And so, thank you all for being here, for listening to it, and have a nice week. Take care of both your mental and your physical health. Thank you very much.
Thank you.
Thank you for having us and for the chat.